In light of the discovery of the latest variant of concern hailed by the WHO as the Omicron variant, Indonesia announced a travel ban on foreign citizens from several southern African nations in a bid to curb the spread of the new variant of the coronavirus. Luhut Panjaitan, the government official in charge of Indonesia's pandemic response, states that foreign nationals who had been in South Africa, Botswana, Namibia, Zimbabwe, Lesotho, Mozambique, Eswatini, Malawi, Angola, Zambia, or Hong Kong in the past 14 days would be denied entry into the country. The new rules would enter into force on the 29th of November, and the quarantine period for all those who arrive in Indonesia from abroad would also be increased from 3 to 7 days. Indonesia was one of Asia's hardest hit countries by the pandemic. Its COVID-19 caseload, which peaked around 56,000 daily cases in July, has declined considerably, with around 300 recorded cases a day in the past week. Meanwhile, South African President Cyril Ramaphosa on Sunday criticized the travel restrictions imposed on his and other Southern African countries and urged the people of his nation to get vaccinated as soon as possible. South Africa's latest surge of COVID-19 cases is apparently driven by the new Omicron variant that is leading countries around the world to impose new restrictions. Vaccination was by far the most important way to offer protection against variant and to reduce the impact of the fourth wave, the president said in a televised address. There was no scientific justification whatsoever for keeping the restrictions in place, Ramaphosa continued, and the World Health Organization classified it as a highly transmissible variant of concern. Though its actual risks are not yet understood, early evidence suggests it poses an increased risk that people who have already had COVID-19 could catch it again, as the WHO said. Meanwhile, Botswana's Minister of Health on Sunday said he was concerned about attempts to stigmatize his country following the identification of a new coronavirus variant of concern. Dr. Edwin Dicoli referred to the naming convention of the World Health Organization, calling the variant Omicron after a letter in the Greek alphabet to avoid an association with the countries it was first identified in. Botswana's International Affairs Minister Dr. Lemugang Kwape echoed the call to take a cue from the WHO, adding that the government was in conversation with the US and the EU to facilitate vaccine production in the country. The WHO had commended South Africa and Botswana for quickly informing the world about the new variant.
We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people. There is no scientific justification whatsoever for keeping these restrictions in place.